Hello everyone, starting with the name of Allah who is the most merciful and beneficial. So it's me Dr. Mazhar and you are watching the third lecture of neuroanatomy. So today we will talk about the anatomy of occipital lobe as well as physiology of occipital lobe. So first of all, I would like to give you a brief introduction about the occipital lobe, what's the anatomy, and then we will go what's the link between occipital lobe and visual system, and then I will talk about the physiology. Okay, so that's how we will talk about the occipital lobe. So basically occipital lobe is present posteriorly of the cerebrum. So this is the occipital lobe. So occipital lobe anatomy, that it is the posterior to the parietal lobe, so it connect with the parietal lobe. So this is the basic anatomy of the occipital lobe. So what's the main physiology of the occipital lobe? Actually, occipital lobe is responsible for the visual system. So it is a primary center for visual when you visualize something. So first of all, when light passes through the cornea, then and it affects on retina. So then optic nerve go through from different pathways and then finally reach in the occipital lobe. Then occipital lobe visualize, understand and recognize the picture. Then it gives again send message to your eye again through optic nerve, and then you can visualize everything very clearly. If someone have any problem in the occipital lobe like stroke or any visual epilepsy or any conversion disorder or any psychological issues, so if occipital lobe will be affected, so patient develop visual hallucinations. If for example some epilepsy or seizure irritates some point in the occipital lobe, so that point can what they disrupt the normal function of the neuron. So as a result, patient develop visual hallucination, that patient sees something that actually not present. And so this is a major function of the occipital lobe, that it also maintain the balance. Because for example, when someone bite on your foot, so your eyes look downward, so it's through the tract. So there is a optic tract, spino-optic tract, that the tract which give the information that something is biting on your foot or any part of the body. So your visual system move or visual system do any action, so visual system can recognize what actually happened. So this is also another function of occipital lobe, that it also responsible that actually what thing can biting on the foot. So this is the also awareness of the visual stimuli. So your visual is the system which can maintain and coordinate your balance. If your occipital lobe is not working very well, you cannot stand properly. So this is the coordination problem can happen. There is no proper gait, we call ataxia. So this is how this occipital lobe present. So this is the picture in which you will see there is an optic tract system, right eye and left eye, and the optic tract, there is an optic chiasma, this is a pituitary gland, and this is the optic chiasma. This one is the optic chiasma, and then there is the optic tract. This is the optic tract, this is the optic chiasma, and they finally reach in where? In the occipital region. So this is the occipital region, which is a primary cortex for the visualization. This is how. And if someone develop pituitary adenoma, so they also suppress the optic nerve. If someone develop any tumor here, it also depress the optic nerve. And if someone develops stroke here in the occipital lobe, so it also disturb the visual system. And this is also a visual cortex system, left eye and right eye. This is the optic nerve, optic chiasma and the optic tract and lateral geniculate body. So this is how, see, right side fiber, also some fiber go into the left and some fiber go into the left eye, and also left side some fiber go into the right eye and some go into the left eye. So this is also crisscross, because right lobe is responsible for left and left is responsible for the right. So I hope so you understand. So in my next lecture I will talk further. Okay, thank you.